We had access to the community that needed the services, and the University of Utah had the resources to provide that service. It was a match made in heaven.
The Utah Department of Health ranks Midvale as an area with high health disparities. We have about double the rate of those in poverty compared to Salt Lake County. Having a clinic like Community Building Community here and embedded in our city is incredibly helpful for our residents who may not be able to afford those services otherwise.
The clinic is serving almost 3,000 people that depend on this care. Not only because of the high quality service that we can provide, but also because they trust us.
The University of Utah is a teaching institution. When patients receive care at the University of Utah Hospital, they almost always see a student or another learner first, who's then supervised by a member of the faculty. That's exactly the model we use here. The students see the patients always under the close supervision of our faculty.
The quality of care that the students are providing, not only does it meet, but it actually exceeds what patients can get in other clinics because of the time that they spend, the individualized approach.
We spend an hour plus looking over each patient's chart, talking to them about the symptoms they've been having.
I think the patients feel that we really do care and we want to do the best that we can for them.
Med students bring an amazing energy to 4th Street Clinic when they're here. That's great for our entire clinic. We see some pretty intense pathology here, and it's really what they went into medicine for.
Getting to work in an environment like this opens your eyes to things that exist beyond just what your structured clinical curriculum is.
The way that medical school curriculum has been set up for decades is that your first 2 years are primarily academic work, and it's hard to really get into that role and feel passionate about it. But you come here to Midvale and you see patients who are dealing with these long-term chronic diseases.
It's easy to feel a kind of a distance when you're just in a classroom all day. There are conditions now. When I hear about it or think about it, I don't just think about like the textbook list of symptoms, but I think about this one patient that I saw at Midvale. But also I remember them telling me how they felt about trying to deal with this condition.
Siempre tiene que haber una confianza para uno poder estar más tranquilo cuando uno visita al doctor. Porque si uno está tranquilo, uno puede hablar bien. A mí siempre me han dicho, tu salud es lo importante. O sea, que ellos no miran ni tu situación económica, ni tu raza, ni nada. Ellos lo único que están enfocados en que quieren salvar una vida.
When they go to subspecialty clinics or clinics in the university, they get to see the patients, but they see them in one point in time. Here, they serve as the primary caregiver for this individual. They learn the art of caring for the patient.
Working in a clinic like this is where Utahn providers get their start. This is where they get their first exposure to the Utahn community and all of its diversity and all of its beauty. By participating in clinics like these, you're only going to build better providers.
We hope that the model that we have created here in Midvale can be used by other communities.
Porque la población está creciendo cada día más y gente lo necesita.
I hope that all leaders in the community would realize what an asset this can be.
I'd like to see every community step up and try to have this type of student-led clinic. I'm so thankful to have it here.